We want to go ahead and bring in Ruthanne Sudderth. She is the Senior Vice President for Public Affairs and Communications with the Michigan Health and Hospital Association. Great to have you back with us here on the show, Ruthanne.
Thank you for having me. Appreciate being here.
So obviously a lot of the conversation right now is shifting from testing for COVID-19 into the vaccine. With that, we've been pretty successful in getting the vaccine, but there are still a lot of glitches in the logistics of trying to get the shots in the arms of the individuals that need them. Can you give us an update?
Absolutely. We are excited to have moved into this phase of vaccinating Michiganders against COVID-19. It is, the beginning of the light at the end of the tunnel, so to speak. And we started this process in mid-December, and so we're about 7 weeks in now. And what we've seen is, a bumpy start, and now we are closing in on 1.1 million shots in arms, which is a tremendous accomplishment, nearly 10% of our population. And hospitals have administered about 550,000 of those. And it's been a learning curve as we understand what hospitals' roles are, how we can work together with local and county health departments to ensure that people understand where to go for their vaccine. And so far, the limiting factor has really just been supply. And that's not a unique problem in Michigan. Everyone wants more vaccine. The faster we can get shots into our state, the faster we can move through our priority groups and make sure that we can get back to normal life here in Michigan.
So you do understand the frustration for individuals who are out there trying to make appointments. And plus you got to keep in mind that a lot of seniors are not online. They're not tech savvy. What advice do you give to people who are trying to sign up for the vaccine? Should they go through their county health department, their local hospital, healthcare provider? What is the best route? Or do they try anything and everything?
That's a great question. And we understand that everyone is anxious to get their spot in line when it's their turn. And so there are there's a variety of options depending on your comfort level with, going online. I would say that if you are a person over 65 or in one of the current categories of essential workers that are being offered the vaccine, and you have a strong relationship with your local hospital or health department, those systems have invited those eligible people to sign up either online, but they also have phone systems set up where you can call in many cases. So our hospitals are working to ensure that there are access points available for those who may be less tech savvy. But I will say that the state is shifting to a model where more vaccine is going to go to health departments than to hospitals. And so checking with your local health department, either on their website or if appropriate via a phone call, is another way to do that. At this point, most retail pharmacies like Myers aren't getting vaccine yet. So right now, checking your health department website or your hospital website is going to probably be the first step, or by calling them.
But I believe the Biden administration did just announce that pharmacies will start to get those, such as your CVS and your Rite Aids and in your Myers. What is that timeline? Do you know?
We don't know precisely. They just announced that yesterday morning, I believe, and it looks like there's 1 million doses that will go to pharmacies across the whole country. So that's not a ton, and it's a pilot program. So we're waiting to see more about where exactly those vaccines will land.
Yeah, so that's a good point. And like a million, when you're looking at the entire country, very small. So continue to go down the routes and the avenues that we are already suggesting and advising. The big question with me and some of our friends too, for the individuals that have already had COVID, should they try to be getting the vaccine, or if they do fall into the allotment of the people that are eligible right now, if they've already had COVID, should they just wait and maybe give that vaccine to someone else?
That's a great question. If you've had COVID within 90 days, you're likely to still have, the stronger immunity. But if it's been longer than that, your immunity starts to go down. That's what we're seeing. And so while, it would be a noble thing to do to give your spot to somebody who hasn't had the virus, we do want to be sure that if you are in an eligible population, that you are signing up for the vaccine and not not avoiding that for too long. Again, that 90-day mark can be a helpful benchmark for folks considering that very question.
I was really surprised to see the mayor of Detroit open up the window of vaccines to individuals such as grocery store workers and restaurant workers, people of that nature, because it seems like there's still a huge backlog with individuals that are 65 and older or those that have underlying health issues.
Yeah, that news came out recently, and I can only speak for the hospital community and that we are still following the state's priority groups. We have not started into additional workers such as food service workers. That would be a question for the city and perhaps the state on understanding the exact reasoning behind moving into those groups at this point.
Ruthanne Sudderth with us here on the MegaCast. She's the Senior Vice President, Public Affairs and Communications for the Michigan Health and Hospital Association. I will say I'm kind of excited to be at the back end of the bus when it comes to the vaccine because there still seems to be so many questions. And I'm also hoping the Johnson & Johnson vaccine comes out because I would much rather get one shot rather than two. But we're also hearing there's a new study going on about can you mix these vaccines? And for the individuals that have already had their first dose, should they look into it, of getting that second dose from Moderna versus Pfizer or vice versa?
At this point, it's very important to get the same second dose as the first dose. So if you got Moderna, get your second Moderna and get it at the same provider location. People need to go back to wherever they got their first shot because that's where the second doses are being shipped. And so that's the important thing to do right now. It's very early on in the studies about mixing vaccines and understanding that if we get to a point where there's a shortage, will it be effective to get a different type of second dose?
So where are we on the state levels as far as how many vaccines are we getting, and are we starting to get more because it has been such a slow start to this process?
Yes, we started out with quite a bit, and then it really the numbers dropped a lot, in early January, mid-January, and so we were very excited to see President Biden announce that there will be 16% increases in state allotments, and now another 5%. So that's a 21% increase. That's tens of thousands of vaccines more, into Michigan than we were getting in previous weeks. So that's great news. And in terms of nationally, we are currently sitting right around 7th or 8th in terms of total number of vaccines given. And we had started much lower in the ranks earlier on in this process. So Michigan is a leader in a lot of things, and we want to be a leader in vaccinating our state as well.
Most definitely, because there have been a lot of issues with this. I know that Mark Hackel, the county executive for Macomb County, has been making a big issue of his county not getting what he believes to be a fair number of some of these vaccines. And I know that you can't speak to how they're being distributed to individual counties and things of that nature, but also for the people that are still hesitant about getting the vaccine, what do you want them to know?
That's a great question. We want them to know that despite this vaccine being developed more quickly than some others have been developed, safety steps were not skipped. This vaccine has gone through rigorous trials and peer review, studies and very intense scrutiny at the CDC level by a group of medical professionals who do this for a living. And they have determined that the vaccines available are safe and effective. And that's the most important thing for people to know. They would not be out there if that were not the case. And we're seeing most of our healthcare providers take the vaccine, and now luckily a lot of other community members. So it's safe and effective. It went through the same types of processes that all other vaccines go through to demonstrate that.
And obviously there are additional vaccines that are in the process of getting approval, which will help speed up trying to get the entire country to herd immunity so that we can be on the backside of this pandemic. But with that, your thoughts on some of these people, we're hearing a lot about line cutters, people that are able to get the vaccine that really don't qualify for it right now. How is that even able to happen?
Yes, first I want to say that we've got 10 million people in our state, and all of their lives are equally valuable, and so no vaccine is wasted. But we also want people to wait their turn, and the people doing the vaccinations are doing everything they can to verify that folks who are getting the vaccine are qualified to do so. So it's not been a perfect process, but everyone's trying to do better and do their best to ensure that our most vulnerable people who are in those priority groups right now, especially our seniors and our teachers, are getting the vaccine, and are at the front of the line.
Yeah, it's so important to know that as well. And uh, as we go forward, so much of the conversation has really shifted to the vaccine. What is the latest, though, really happening with testing? Is there still a backlog at some of the labs at trying to get the test, back so that we can make in like a timely fashion?
Yes, getting that test back quickly is so important so that people don't go back out and into the community if they know they have COVID, or if they don't. Luckily, testing has been a very smooth process in the past several months, especially compared to early on. It's much easier to get a test now, and there are a lot more sites to do so. We haven't heard of any significant backlogs. And I know that folks can go to places like their hospital or their health department or the CVS down the road and get a test and get their results fairly quickly at this point. So the state has a really great test finder tool on the michigan.gov coronavirus website, and people can definitely check that website if they're looking for a place to get a test.
Well, great information for all of our listeners and viewers. And so Ruthanne Sudderth with us she's the Senior Vice President for Public Affairs and Communications with the Michigan Health and Hospital Association. We appreciate your time, but also your expertise on this subject.
Thank you so much. I appreciate being here.